Hello everyone, or to anyone who is watching this. My name is Aubrey Brown, and welcome to my video podcast. Today I'm going to be arguing the critical argument of socioeconomic disparities being the primary driver to obesity in rural America. So let's get started. So for starters, I just wanted to define obesity for you guys. So generally, obesity is defined as a condition characterized by an abnormal or excessive fat accumulation, and it is very, very common in the US. More than 3 million cases per year are diagnosed. And being obese is measured on the BMI scale, also known as the body mass index scale. And then there is a fine line between being just overweight and then being obese, and the difference is also defined on the body mass index scale. Obesity is more like a disease, whereas being overweight is just a problem, and it's also known as like pre-obesity, so it's just something to be aware and cautious of. So in Ashar's study, Ashar highlights how low income, limited healthcare access, and food deserts contribute to high obesity rates in rural America. Ashar talks about how rural America faces an alarming obesity crisis, and he claims it's due to socioeconomic disparities, limited proper access to healthcare, structural challenges like food deserts, and insufficient healthcare infrastructure. He also provides thorough solutions to the obesity problems in rural America. And for those of you who don't know what food deserts are defined as like regions where there's limited access to healthy and affordable food. So just rural areas, places that don't have like healthy food. Healthy food is generally also more expensive, especially if you go to the grocery store and you look for or more organic foods. They're gonna be more expensive than like foods that are like genetically modified or like junk food like chips or something. They're typically going to be like not as expensive as something healthy. And then as far as insufficient healthcare infrastructures, this is just referring to a lack of adequate like facilities and resources and like support systems necessary to deliver the proper healthcare services. And this can be caused by unlimited access to healthcare services, such as geographic barriers, like long distances and like lack of transportation. That can like hinder visitors to like get there on time or like access them, period. And then scarcity of healthcare professionals. I'm sure everyone knows this, but there's a lack of like healthcare workers like nurses and surgeons and people who can provide the proper service and like are skilled enough to do so. And then outdated technology systems. Like technology is continuously advancing, and as it's advancing, it's getting more expensive, and rural areas might not be able to afford more modern medical data and information. To go along with this, like addressing all of these challenges requires a significant investment in infrastructure development and modernization to ensure equitable access to healthcare services, and that's just very difficult to achieve in rural communities. And then also in Maina's study, she researched and observed the prevalence of obesity in groups of people with higher socioeconomic status or people who hold higher educational status. And her research resulted in like people with higher incomes in their household, they hold health, mood, and sensory and weight concerns on a higher pedestal than people with lower incomes. The fact that they are just more concerned with weight gain prevention, and they care more about their well-being because they can afford to live luxuriously and eat luxuriously and actually like have the options to eat healthy, whereas people with low incomes don't really have the option. They just get what they can while they can. And then surveys also showed that people with better, longer school or higher education also prioritized good and healthy eating habits, because they noted and are aware of healthy food relationships, so they know what's good in food and what's not, basically. Know and understand the risks of not eating properly and like eat versus like eating foods with like GMO. A common counter argument might be that some might argue that personal responsibility and lifestyle choices are the main factors influencing obesity, regardless of socioeconomic status. But this can be refuted by the fact that obesity is a very complex disease. It's a multifactorial condition, meaning like there's many things that play into obesity becoming or being so common, such as like genetics, environmental, psychological, nutritional, and metabolic factors, and these are all scientifically proven. So not only socioeconomic reasons are the being of obesity being so common, in my opinion, in my research, that's just the main one, but there are also very many other factors that play into it. Also, environmental factors can be a reason, such as urban design and availability of transportation. So some people or some countries or places might not have public transportation, like a train or a subway or Uber or taxi, and even if they did, transportation can also be very expensive, so that rolls back to the socioeconomic problems. Also, stress plays a big factor as well. Limited recreational spaces, those things can cause little motivation as well. So and then public policy and social determinants. So public policies and social determinants of health, such as like education, employment, and housing, influence health outcomes. Effective policies can create disincentives for unhealthy behaviors and promote healthier lifestyles. While emphasizing these points, you can argue that while personal responsibility is important, it is only one piece of a much larger picture. Obesity should be understood like within the broader context of societal, environmental, and policy influences. So even though responsibility and lifestyle is just a small portion, you have to consider also the bigger picture, and there are much larger problems than the ones that are like surface level, like lifestyle and responsibility. All of this being said, I think it's most important to just accept people for who they are, and like how they come, rather than judging them. We as people easily form opinions and stereotypes, which is contributing to people not getting the help they need for their disease like obesity. Even though low income and food deserts and there's underlying issues in obesity being so common in rural America, I think in the bigger picture it's most important to be accepting of others as they come, even though they have a disease, because they're more likely to be encouraged to get help. And we as humans can help them and encourage them to get the help that they need. But we can't be encouraging and helpful if we're not accepting of who they are as they come. It's made differently overall, and no one's gonna be perfect. Also, there's more than 3 billion people in America who are diagnosed professionally with obesity and who struggle with it, and 3 billion are diagnosed. Imagine how many people are undiagnosed because of the medical barriers that are keeping them from being diagnosed, such as stereotypes or accessibility or low income, like people who can't afford doctor visits. So if we're more accepting of people, they're more likely to go and get the help that they need, or they're more likely to be funds geared towards people who need that medical attention. Thank you everyone for watching. I hope this video was helpful. And again, all of my sources are going to be in the description. That's all for now.